Good afternoon, and thank you for joining us at our second of three Lunch and Learn sessions. Put your oxygen mask on first, thriving through the postpartum period, presented by the Newton-Wellesley Hospital Maternity Services Council. Today's session will focus on the emotional changes that come with the birth of a baby. My name is Dr. Veronica Bloom, who is a mom of 4 children in their 20s, and I am thrilled to be able to moderate our 3-part lecture series during May as a way to celebrate Mother's Day. Please note that we will be recording the keynote speaker's presentation, but we'll stop the recording during the Q&A so panelists and audience members are comfortable asking and answering sensitive questions. Please feel free, and we encourage you to type questions into the Q&A feature anytime during the presentation. Following the 3 sessions, all registrants will receive an email with a copy of the recording as well as relevant community resources. It is now my pleasure to introduce today's presenters. Buffy Sheff-Ross, MSW, LICSW, is a graduate of Boston University's School of Social Work. She is a clinical social worker at Newton-Wellesley Hospital, providing therapeutic interventions and referrals to community resources for patients with postpartum depression, anxiety, and other psychosocial issues. She's an advisory board member of the Mass PPD Fund and a faculty field advisor at Boston University's School of Social Work. Buffy lives in Newton with her husband, 16-year-old daughter, and their 2 Tibetan Terriers. Our moms today who will color our presentation are Colleen A., who has lived in Sharon for over 2 years now. Her son Robert is 8.5 months old, and her husband is a paramedic in Quincy. Colleen will go back to teaching 6th grade science in Waltham in the fall. We also have Tasha Lamarca, who is a mental health educator, trainer, and curriculum designer, specializing in middle school and high school education. She's a self-professed mental health and nutrition geek and a mom to an inquisitive, quietly perceptive, and loudly stubborn 15-month-old whose name is Roselle. She currently lives in Waltham and loves walking along the river and being outside in nature. I will now turn it over to Buffy for the feature presentation.
Thank you, Veronica, and thank you everyone for joining us today. As a clinical social worker here at Newton-Wellesley Hospital, we'll talk about the emotional aspects of the postpartum period. May is Mental Health Month, so it's a perfect time to talk about mood changes during pregnancy and postpartum. This is an important topic as maternal mental health is a serious complication of childbirth. 75% of women who experience maternal mental health symptoms go untreated. This is due to lack of access to mental health providers, affordability, availability, and stigma, just to name a few. For the past 3 years, my role at Newton-Wellesley Hospital has supported women during their pregnancy and postpartum. Educating and supporting our mothers, both physically and mentally, is very important to all of us here at Newton-Wellesley. Patients are referred to me by providers in their OB practices, and I have spoken to over 1,200 women in my time here, and I thought I'd share some of the most common things I've heard from our postpartum mothers. What did I sign up for? I'm feeling defeated. It's impossible to be a perfectionist. I didn't know it was going to take this long for my body to heal. I miss my old life. I miss being pregnant. I'm overwhelmed and sad, and it's affecting my day-to-day. I'm crying, and I have these irrational fears. I'm just not feeling myself. For some, the transition to parenthood is not easy. The feelings of isolation are challenging. Many struggle with the change in identity. And what I commonly hear, and it's really hard to admit and say, I'm a little off. I'm just not okay. I don't know if this resonates with any of you. Karen Kleiman is a licensed clinical social worker, author of many books on postpartum mental health, and founder and director of the Postpartum Stress Center in Rosemont, Pennsylvania. She teamed up with illustrator Molly McIntyre to create comics that depict the silent struggle of postpartum distress. And what stands out to me the most in this one is I don't know what I'm doing and why don't I have the right instincts? I'm sure you have other ideas too of what this says to you. The postpartum period is a roller coaster ride of emotions with lots of ups and downs. With the stress of caring for your newborn, along with the lack of sleep, a drop in hormone levels post-delivery, and a range of emotions can often trigger what is known as the baby blues in the days or weeks after giving birth. It can be difficult to navigate due to the feelings of loneliness and isolation. In addition, symptoms can appear differently for everyone, but we know 4 out of 5 mothers experience symptoms. Of course, there's a period of normal adjustment after having a baby when mothers feel exhausted and overwhelmed. Symptoms can be mood swings and sadness and irritability and crying. But with time, patience, and good self-care, that sleeping and eating and hydrating and positive support from family and friends, symptoms will fluctuate and usually disappear within a few days or weeks after giving birth. If symptoms are lasting longer than 3 weeks to several months after birth, the symptoms are interfering with your day-to-day life, affecting your quality of life, are severe that you are questioning it could be something more, you could be suffering from a perinatal mood and anxiety disorder. Postpartum depression and anxiety is more commonly used, but the term perinatal mood and anxiety disorders, or PMADS, really includes mood, and that's depression, anxiety, bipolar, obsessive compulsive disorder, post-traumatic stress disorder, and psychosis. We know that 1 out of 5 women experience depression or anxiety during pregnancy or postpartum, and that 1 out of 10 fathers experience paternal postpartum depression. Prior to the pandemic, these numbers were 1 out of 7 women experienced depression or anxiety during pregnancy or postpartum. Every year, more than 400,000 infants are born to mothers who are depressed. Research shows that depressed and anxious parents often smile less, talk less, and are less likely to touch or engage with their newborns throughout the first year of life. When left untreated, it can have profound adverse effects on women and their children. It can happen to anyone, and that symptoms can begin at any time during pregnancy and within the first 12 months after delivery. Many of my patients report they kept thinking they were going to get better. If I just get a little more sleep, if I get a little more help, but you don't need to struggle waiting for your mood to improve. These mood changes are temporary and treatable with help and support. Speaking to your OB or primary care doctor will help lead you to the right treatment. And that treatment could be talk therapy, medication management, and/or a combination of both. I'd like to share a tool used to help providers assess for postpartum depression and/or anxiety. The Edinburgh Postnatal Depression Scale, also called the EPDS, is a 10-question tool asking how you felt in the past 7 days, not just how you're feeling today. It's used to identify women at risk for perinatal depression. The scale is available in many different languages. You'll find that many pediatricians are also using this tool to assess parents' mood during your child's first year. The responses are scored 0, 1, 2, or 3 according to increased severity of the symptom. Items marked with an asterisk are reverse scored, 3, 2, 1, and 0. The total score is determined by adding the scores together for each of the 10 items. The maximum score is a 30. Patients who score a 12 or 13 could be struggling with a depressive disorder. This tool also helps us identify those struggling with suicide ideation, so we pay close attention to the answer on question 10. At Newton-Wellesley, we ask our patients to complete one at the initial prenatal visit, 24 weeks gestation, 6 weeks postpartum, and 6 months postpartum. Those patients who score a 10 or more are referred to me, and I provide therapy, or I refer patients to therapists or providers for medication management in the community, but I also have knowledge of support groups and other concrete needs someone has. And here's another graphic by Karen Kleiman and Molly McIntyre. And I think this one just says so much. Are there things that maybe you would add to this? To me, this graphic just screams, I just need to feel like myself again. So it's brave to admit that you need help. The sooner you reach out for help, the sooner you can start to feel better. Talk to a friend or a family member. Speak with your healthcare provider and explain your symptoms. Speak with a mental health professional as they can help you develop effective tools to manage your symptoms. Remember to take care of yourself, and please don't ever forget that you're not alone. This list of healthy coping strategies can be used during pregnancy and postpartum, probably at any other time in your life, but I cannot say enough about your sleep hygiene and how important it is to you during your postpartum period. If you're struggling with sleep now, I really encourage you to speak with your OB about it. Your postpartum days will be busy, but making food ahead of time will help you so that you're not starving by the end of the day. Can your partner make breakfast? Can they leave lunch for you already made? And hydration is really important. Do you need a new cute water bottle just to inspire you to drink all day? Creating a daily routine and schedule, which is difficult with a newborn, I get it, but keep it to the basics, eating a balanced meal, sleeping when you can, performing daily hygiene, wearing clean clothes, and getting some fresh air. I encourage you to move in some way. Getting outside for at least 30 minutes a day will help you and the baby. Meditation apps, journaling, even gratitude journals are some ways some find helpful to decrease stress and anxiety. Grounding exercises can also help manage anxiety. Massage and acupuncture are other ways to relieve stress and tension. Stay connected to others is essential for our well-being, and I encourage all of you to connect with friends and join a postpartum support group. Newton-Wellesley has a wonderful, well-attended postpartum support group run by our incredible midwife, Angela. We also have a fabulous breastfeeding support group. There are many other postpartum support groups provided by communities as well. Self-care and grounding strategies, and self-care is not selfish. Remember to take the time to continuously ground yourself with breath, mindfulness, and physical movement. Did you try a prenatal yoga class? Can you do a little stretching? Remember to laugh with your partner or friend. And I cannot stress enough, make the time for you and your partner, and make sure each of you are able to have your own time for self-care. So celebrate the small wins. The baby latched for 10 minutes, or you showered today. Asking for help can be a difficult thing for a mother to do. Practice asking with those you are closest with, a partner, maybe a family member. Communicate your needs to your partner, your friends, your family, your OB, your pediatrician. There are also community resources such as Postpartum Support International, there's McPap for moms, and now there's a new maternal mental health hotline for expecting and new mothers experiencing mental health challenges. Talk with your partner about a sleep schedule. Do one of you have to sleep in another room while it's your turn to sleep? Family, friends, and neighbors will ask you if there's anything that they can do for you, and just say yes. Keep a running list on the refrigerator of tasks that need to be done. There will always be things that you need help with. To be a healthy mom, consider taking breaks from your newborn. Mothers often suffer in silence because guilt, shame, and fear make it difficult to admit what's really going on. But if you don't talk about it, you can't get the support and help that you need. Talk to your partner, talk to your family members or moms you trust. You don't have to wait until things get worse before asking for help. You don't have to settle for a few good days when you deserve so much more than that. I have one last quote from a mother who I worked with a few years ago. And she said, reach out to friends, talk about how you're feeling, tell everyone. It will help you feel better. So here's my shameless plug for support groups, as I cannot say enough about them. We have wonderful groups through the hospital and in the community. Most continue to be virtual, which can be good because you really don't need to leave your home to connect with others. There are some women who participate in groups every day of the week during their postpartum. And again, we'll send this out after we meet today. And on May 6th, the U.S. Health and Human Services Department's Health Resources and Services Administration announced the launch of the National Maternal Mental Health Hotline, a new, confidential, and toll-free hotline for expecting and new moms experiencing mental health challenges. By calling this number, you can connect with a counselor at no charge. It's available 24 hours a day, 7 days a week, every single day of the year, in English or in Spanish, and any other language by request. So again, we'll send this all to you after. And we'll have our community moms come on now.